some of you, your gadgets and your car get better care than your health. Today, you need to repent. In fact, you will repent now. Welcome to another episode of Health Talk with Dr. Mo. And today we're going to be talking about annual health screening. Why is it important? What are some of the tests that you can do to ensure that your body is in perfect health? So, annual health screening is when you go to the hospital at least once in a year to go and do a physical examination and a blood workup. And what do you do during your annual health screening? Your blood pressure is checked. Your blood pressure is important, especially if you have a family history of hypertension. However, the way the blood pressure is being done has to be very, very accurate because there's some mistakes that are being done, which can give to false readings. Hypertension is a disease that can affect the eyes, the heart, and even the kidneys. So your blood pressure is very important. Another important blood test is the blood glucose. The fasting blood glucose is very accurate in this situation, especially if you have a family history of diabetes. Many people are pre-diabetic. That means that they have not gotten frank diabetes, but they are on the borderline. And so care needs to be taken. Lifestyle modification, diet, and even some medications might be prescribed by your physician so that you do not go into frank diabetes. Diabetes is not a good disease because it also affects the brain, it affects the eyes, it affects the heart, and it affects the kidneys as well. What other tests do you do when you go for a blood workup or an annual screening? You need to also check your body mass index. Your body mass index is looking at your weight versus your height. So what that says is we want to know whether you're obese or you're underweight. If you are obese, there are some things that needs to be done because obesity is a risk factor for many diseases, including cardiovascular diseases. Also, you need to do a pap smear. As a woman, if you're within the ages of 21 to 65, at least you need to do a pap smear once every year, and then your doctor will tell you whether you need to repeat it and the duration. This is because what the pap smear does is it helps you to see whether you have the HPV infection, the phenotype that causes cervical cancer. Cervical cancer is preventable, and there are even vaccines to be given to prevent cervical cancer. What other tests do you need to do? For a man, it is very important for you to do your prostate specific antigen test. This is your PSA test. It helps you to check the size of your prostate, whether it is enlarged or whether the values are so high and probably a suspicion of cancer can be made. And this is also important because then you know how much of your health of your prostatic antigen is rising. If already you've had a baseline which has been increased in the last few years, it is better for you to check it regularly so that you know if there is an upward rise or trend in your PSA. Also, you need to check your vision and your hearing. Diabetes and hypertension and some other diseases affects the eyes and the ears, and you don't want them to get to the later stages before you do something about it. So it's better to always check your eyes and your ears for anything that might be coming up which is not showing as a symptom yet. Another one that you need to do is for smokers. Smokers are also at risk of getting lung cancer. So it is important to do a lung cancer screening test. This will help you to know what is going on in your lungs. Now, with all this that I've told you, I want you to make a promise. Make a vow. Raise your hand and put in your name. I, put in your name, will promise that I will do my annual health screening and I will make sure I take care of my body as much as I take care of my gadgets and my car. So, if you like this video, please share, subscribe, and click the like button. And then I'll see you later in the next episode where we'll talk more about health. Remember, health is wealth. Thank you.